The next presenter is Dr. Trupti PATIL. She will speak on focal disc damage, structural and OCT angiography of the optic disc and macular parameter correlation. Dr. Trupti is here? Okay.
Good afternoon everyone. Today I am going to talk about the focal disc damage with hemifield loss, a structural and OCT angiography based analysis of the optic disc and macula parameters and their correlation. So as we all know, OCT do help us to detect a focal change, be it a vascular or the structural change. We have earlier studies have shown that the vascular parameter do provide complementary information to structural change. But however, the benefit of vascular parameter over the structural parameter is still uncertain. So aim of our study was to evaluate the correlation between the optic disc and macula parameters based on structural analysis and vascular density analysis, and also to evaluate the diagnostic accuracy of the same. So we included the patients with primary glaucoma who has focal disc damage with single hemifield loss more than 18 years of age, and the focal disc loss was measured as focal rim thinning less than 4 clock hours. We excluded any patient who had poor scan quality, media opacities or high refractive errors. So all patient underwent comprehensive eye examination including the optic disc photograph, the OCT structural analysis as well as vascular density measurement for both disc and macula, and visual field test. So we had total 103 eyes of 64 patients, out of which 75 had focal disc damage. So we divided them into four groups. Group 1, where the patient had focal disc damage with central visual field loss, were compared with those without the central visual field loss. While in second, we have group 3 and 4, where the group 3 patient who had unilateral disc notch and contralateral healthy disc were compared against each other. So when we for demographic details, the mean age of presentation was 56.7 years. Majority patients were phakic. The most common type of glaucoma was primary open angle glaucoma, and the most common location of damage was inferior. So when we compare the structural parameter of the optic disc and macula, what we noted that the average the retinal nerve fiber thickness was significantly different between the notch versus no notch. Similarly, the vascular density parameter were also different only between the notch versus no notch group. While in case of macular thickness parameter, they were found to be different between both the group, and visual fields parameters were different between all the four groups. So when we analyze other parameters for disc and macula, for the optic disc parameter, what we noted that the average rim area, average vertical CD ratio and average inferior density perfusion was definitely different between both the groups. And among the macular parameters, only inferior quadrant thickness and average GCL IPL thickness and minimum GCL IPL thickness was found to be different between both the groups. So when we studied the correlation between the optic disc and macula parameter, the structural parameter definitely shows substantial correlation, while vascular density parameter showed weak correlation. When we assess the strength of association, it was definitely better for the structural parameters and it was weak for the density parameters. And the area under the curve was definitely better for the structural parameter as compared to angiography based parameter. So when we have a patient with focal disc damage, yes, we do get changes based on structural parameter as well as angiography based parameter. However, the correlation between the optic disc and macula structural parameter definitely shows stronger correlation. The strength of association is stronger, and the diagnostic accuracy is also definitely better as compared to angiography based parameter. And Rabilo et al. Have analyzed similar results, and they had attributed it maybe because of the different vascularization of the optic disc and macula. So to conclude, compared to angiography parameters, definitely the structural parameters has better correlation, highlighting the importance of structural OCT in the era of angiography based OCT. Thank you.
Excellent presentation. So do you think that structural abnormalities are more important than the angiographic pattern?
Yes, I do, sir.
Okay. No, thank